Okay, I'd like to welcome everyone to the second session, all the delegates, the presenters here with us, and the ones online. My name is Sipesi Tlengwenyuso. I am a lecturer at the Human Movement Science Department, and I will be your chair for this session. So our second session has 6 presentations ranging from departmental showcases. We're going to have 4 departments, and then we'll be having research as well as a presentation on entrepreneurship, which I think is going to be quite interesting. So without wasting further time, since we're already a bit over our time, I would like to call our first speaker, Dr. Velma Tenham Baloy from the nursing department to give the departmental showcase. Thank you.
Thank you so much for this introduction. We're just trying to get the slides working. They are. Thank you. So I'm Vilma. I'm from the nursing department. Thank you for joining this presentation online as well. And so I was asked to do a showcase of the research that we do in the department. It's quite a bit, I must say. Don't want to brag, but this is just a snapshot of some of the projects that we're doing. And just to give you a bit of insight. So as you can see, our vision, I'm not going to repeat it, and our mission. So I've just highlighted the research-based education. We are obviously not a research-intense university. However, I think research within the Department of Nursing has been quite well established, but we still continue to learn. So this is our department in terms of specialities. Why I actually have this slide is because a lot of staff that are specialized in a certain area, you will see they also do research in that area. So you can see that it's quite a variety. So it's Dr. David Morton that's sitting at the back, and myself that are in research. And then there's a lot of clinical specialties like midwifery, critical care education. Obviously, as nurses, we all have nursing education as a qualification. So, and we are led by Dr. Nulundi Khadana. In terms of statistics, I try to pull out a bit of statistics. So because of the new curriculum that we've started, we had last year was the very first time, actually the year before, that research proposals as well as the conduction of research projects at undergrad level were done. So at the moment, we had 9 projects last year, but those were from the graduates, so they've graduated. In terms of third-year students, they start with the proposals. Fourth year, they are then needing to do the project. So it goes via ethics, and then they conduct the research and write it up in a draft manuscript and a poster presentation. And that poster presentation is then also, they do that at the end of the year, and they get assessed by that. And we use the poster and the manuscript as well to disseminate it to the various health facilities. So third-year students, 61 proposals, not 61, luckily not, 61 students, and we have 14 proposals, and there are about 18 academic staff members that are involved there. No research associates at that level. Fourth-year students, 55, and we have 11 projects. So at the end of the year, and they're all done in public health care institutions this year. 18 supervisors, so a supervisor in third year will then also carry through in fourth year. Master students, we have 35, and we have 15 academic staff members that are able to supervise because they have a master's. So the 3 others are currently busy with their master's. So we hope that we can increase capacity, because as you can see, we have quite a lot of students versus not so many available academics. and PhD students 26, of which 6 supervisors within a department can supervise them. But we do make use of the research associates. So this is the team of the Departmental Research Committee. And it's so myself, Dr. Morton, it's for administrative assistance, it's Mrs. House, and then Mr. Cabello for the marketing assistance. So the executive departmental committee members, so we meet once a month, and those are with the HOD, the team, and then also Dr. Duplessis and Dr. Smith are part of that committee. And we discuss matters that are research related, that we need an opinion or decision to be made. We also do have a strategy. So we've been looking, and we said 2024 to 2028. There's a lot of work to be done. So we basically have 3 goals, as you can see, and then under those goals are the research activities. So I'm not going to read everything out, but we want to cultivate and strengthen a research culture as the first goal, developing and strengthen and the identified research themes, which I will present, and we strengthen African research engagement and partnerships. The teams, they are also on our website, but they are as follows. I'm not going to, again, read them out, but there are 7 themes. And these are actually the academic staff members that are involved per research theme. So what we've done is we've asked them bio sketches to complete that and to indicate which themes are they involved with when it comes to research. So you can see that under each theme there are staff members. We are still working on this, so this website is not yet 100% updated. But just to give you an idea, that you can see that certain research teams have more staff members than others. And we obviously do have our RAs as well, but these will still be added. So hence I'm saying the website is still kind of under construction. Yeah. So looking at the research project, we did quite a bit, but I'm just highlighting, just a disclaimer, because of Poppy Act, I do have the permission for the photos, but I'm not going to share the slides with the photos. So just because of Poppy Act. The type of research project we have undergrad, this were 2 undergrad students. They have graduated. They're doing the community service at the moment. Ms. Nobo and Ms. Nonkanyana. They had a project on diabetic foot ulcers and management thereof. So they went into one of the private hospitals, and they looked at data that they collected through patient files. So they looked at that data, extracted it, and analyzed it. So it was more like a retrospective study. The next one was also an undergrad research project that won the award for the best research project. It was conducted by Ms. Lamprecht. It was Siana Catrice and also Jalen. So Cornelius, they did the project in MOUs about midwives' knowledge and usage of management methods of laboring women. And that actually that project got an award. And actually Dr. Morton was the supervisor. In terms of masters, we obviously had, it was difficult to pick, but I picked one that's actually a staff member at the medical school. Maybe some of you may know her, Mrs. Cindy Boyson. And she did a project, it was a quasi-experimental study on enhancing nurse educators' knowledge regarding clinical simulation. So that was more like an educational topic that she did. And there was an article published based on her work. Then we have PhD projects. I'm just highlighting one of the most recent, was done by Ms. Chetty, and also a article was published in an international journal, Wiley, Journal of Nursing Management. We also have non-degree projects. So one is done about comprehensive sexual and reproductive health counseling program. It's NOF funded. And then there's also a project by Dr. Morton regarding preparing community health workers to support family caregivers of relatives with dementia. Both are conducted in the Nelson Mandela Bay, and they are both NRF funded. So yeah, NRF is quite a good way of getting research out from our experience. And that is it. Thank you very much. I have the contact details. Feel free to visit the website. Feel free to send an email also if you have any queries or any collaboration or any ideas. We're always happy to collaborate. Thank you very much.
Okay, thank you so much for that presentation showcasing the research done in the nursing department. It's quite interesting. Are there any questions on the floor or online? Do you have any questions, comments? Checking online, okay. Okay, while we check online, I do have a question of my own. I think this has been asked too many times, but I just wanted to find out, since it seems like you're quite a big department compared to my department, and then I saw with your third and fourth year research projects, do you apply for ethics for that? And if you do, how do you go about? Because I think in fourth year we have about 35 students, which for us is a big number, because this year alone we had about 22 students and we've been struggling. So I just want to find out, how do you do it in the nursing department, and how do you go about taking fourth year students through the whole MEOS process, as well as the feedback, like going through all that process?
Thanks so much. So yeah, it has been a challenge because our class is getting larger and larger. So we do obviously group work, so 2 to 5 maximum students per group. We are looking, so they generally do have to go through FPGSC. We try not to go with vulnerable populations or sensitive topics, because then it has to also go through RECH, and also undergrads, they are not as experienced in research. They're just basically learning. So we we invite them to the workshops that were held about MEOS. We kind of all find our feet kind of in it. And also what we're planning to do next year is just have a MEOS workshop with the students. So the fourth year also is very much aligned with where they are in their process of research. But yes, most of the projects do serve at FPG's DRC. So we have a separate DRC for them. There's a mark attached to the presentation that they do there, and then they get feedback, and then they can submit to FPGC via MEOS, and we will do a workshop on MEOS, like to sit with them, and in class they get the laptops and they can actually try to do the application. Then also the other thing that we are looking at now is doing systematic type of reviews. We are still discussing whether that needs to be registered and applied via MEOS, but it is in a way a good way of collecting data and exposing the undergrads to research and methodologies in general, but at least you use the human element is out of it, so there's no risk. So that so we're trying to do that as well, and we're trying to then also capacitate the staff that needs to supervise that. So that's in a nutshell, I think. Thank you.
Okay, thank you so much for that. So that's exactly where we are as a department, because I personally did the MEOS training, but I felt like even though I went through quite in depth, the students still struggled with it. And then I think what shocked them was getting the feedback from faculty, postgrad students studies committee. It was too intense for them, and they were really overwhelmed. And also because they have such a short period of time. So I think we're also going the systematic review next year. So hopefully it's going to help. Okay, thank you. So now with our next speaker, Prof. Smith, that will be giving the showcase for the Department of Medical Laboratory Sciences. Yes.
Thank you for the introduction. Just to comment on my colleague that said they are undercapacitated. We are only 6 staff members in medical laboratory sciences academic. We've roped in our lab technician now because she completed her master's. So the challenges are similar to what you have in human movement sciences. So I'll quickly take you through our presentation. I'm not going to bore you with a lot of information. So to just extract the research mission from our mission, it's basically to advance research to support innovation, strengthen practice, and to inform policy. And that's in line with the Vision 2030 and the vision of the actual faculty as well. The research themes, just to quickly go through them, you can see them there, and then I'll go through them in more detail. Again, like in nursing, we have some of the staff members actually participating in more than one of those areas. And I will be participating in all of them because, yes, the size of the department. So to start off with the medicinal plant research, we have been doing that for a number of years, and most of the staff members, actually their masters, comprised medicinal plant research. One thing that I can say that might help the smaller departments is collaborations. So we do have collaborations with the Department of Pharmacy in the faculty. Something that I haven't added here, but you will see that later, is we do work with the Department of Human Movement Sciences as well. But specifically for medicinal plants, we work with the Department of Pharmacy, and then across the faculties with Department of Biochemistry and Microbiology. We also work with Walter Sisulu University, as we have grown the department through the years. Most of our collaborators were actually students within the department. So they started off with their masters in the department or PhDs in the faculty. And that's also how we then collaborate with Lusaka Apex Medical University, because our collaborator actually did his PhD in the faculty. So mostly we're looking at antimicrobial activity of the medicinal plants, then some toxicity studies. That has become very challenging, and we don't have an animal unit at our university. So it's mostly cell type of studies that we do, and then histology as well. Then something that we have started to do, and the staff member, Mrs. Buckle, actually completed her master's in hybrid learning. And at that stage, it was still called blended learning when she completed her master's, with the help, again, of a collaborator in ICT, Prof. Van Grienen, to just support the students as well. And this was started in 2018 already. So it was at the start of this. at the moment, some of our part-time students, and that's the other challenge, most of our students are part-time students. They specifically focusing on training in the laboratory. So once the student actually completed their degree, they need to be upskilled or just improve their skills in the lab. So that is where we then working with collaborators there as well. Then in terms of parasites, mainly Mrs. Dondi and Mrs. Bielefeld, and this is where we collaborate with it's the Kazi Bantu project, but specifically the Kazi Afaya study that is in the Department of Human Movement Sciences. So basically, we did the analysis of the stool samples of the children to check for the parasites. And then similar, we supporting the Department of Environmental Health in their PhD student, where she's testing some of these parasites as well. Then we're very excited. Our technician completed her master's in blood transfusion, and there again we collaborated with SANBIS, which is the National Blood Transfusion, and then Western Cape obviously have their own blood transfusion services. So we worked closely with them as well to obtain the data. But these type of studies, they do take a long time to get the ethical clearance, then to get the data. So part-time, you're looking at 4 years. So the throughput rate, if you have only 6 supervisors, is slow. So that is why we are looking into systematic reviews for our third year students, where they develop the proposal, and then in the 4th year they will actually conduct the research in groups of 4. And again, it's a challenge because they're busy with their work integrated learning, and in the 4th year they can specialize. Now, if they choose to do it in a specific discipline, you have to accommodate that. And that is why, and I'm not going to bore you with the details of that, there's 10 themes within that they can choose from. And it's all information that's already in the public domain. So and it's basically a review, so they won't go through the MIA system, although we teach them in their 3rd year how to do ethics applications, etc. We just found that students these days do not read. Unfortunately, there's so much available on social media that they can just watch. To actually do a research paper and read that, it's boring. So also to support the students in their 3rd year, they've got what we call journal club. So they will present articles and it becomes part of their research mark. So it's just to change the mindset and to get them motivated and excited, and they do actually get excited towards the end of the 4th year. And then just to show you that we've been forever collaborating with a number of people. So you will recognize Dr. Dambuza, and that was when she was still an honors student with us. And also Dr. Van Heisten, that's now with the medical school. She was busy with a PhD, and we were establishing a medicinal garden. I didn't include the other photos for the papaya, so we couldn't include the traditional healers, etc. And then just to show you, the specific worm analysis with all the stool samples, the students, and I'm sure some of the human movement sciences colleagues will recognize some of the co-workers there as well. There's a few publications, and you can see in our case, we have a number of collaborators. So therefore, and I didn't include it in the first article, that's one from last year, but we also have like 8 authors because different sections of the work will be performed by the different universities, and then we just join it together. So thank you.
Thank you so much, Prof. Smith. That was an interesting showcase of your department. Do you have any questions for Prof. Smith?
Thank you so much for the presentations from nursing department and just the one I just concluded. And it's not a question, it's just a comment. So just appreciate colleagues on the good work they are doing. And I'm excited, really quite thrilled to see the various collaborations within the faculty and even across the university, which is quite exciting. And in the morning, Dr. Denishel presented her slides and the details of how the departments and the faculty can actually collaborate with CMR, where she is the director, is amazing. There are aspects she touched on. She will be here likely for the campfire session. So please, let's engage during that meeting to just see how we can extend and break those boundaries together. Thank you so much.
Thank you. Any other questions? Anything online, Brethlin? Okay, just a comment from my side, not a question, Prof. I really think the experience collaborating with your department was very nice, and also when it came to going inside the lab with the stool, that was something very new for me. And the worst part was the first time I actually collected the stool samples from the school, driving from the northern areas to Nelson Mandela University. That was the longest trip I've ever had from the northern areas to campus. But I think getting to see how everything is done and how people in the lab, I actually used to, I also feel like you guys don't smell anything, which was very weird for me.
That's why I didn't include the photo with the HMS students where they were all wearing masks, because I thought you will think it's because of COVID. It wasn't COVID, it was actually the smell. So the people that's used to it actually don't even use the masks.
No, thank you. And the Gazi Afia study was part of my PhD, and the analysis you did and just your colleagues helping me through that whole process was very nice. So I really like the collaboration, as Prof said, collaboration between across the different departments is very important. And I think it's something that we really need to do more. Like we will look at a collaboration with your department. Okay, now our next speaker showcasing from the Department of Psychology, Prof. Cronje.
Thank you very much. Dis vorentoe daai. Okay. Hi, everyone. Thank you for this opportunity to present and celebrate the work that we do in the Department of Psychology. I was thinking this morning about it being called a showcase, and we all have a mother or a grandmother that has a showcase in the lounge with the tchotchkes in. I also have one, which shows you how old I am. But in the showcase are things that are precious to us. And so it is the things that we want to show off to visitors and to anybody coming to our home. So thank you for this opportunity. What I want to cover today is our mission statement, staff and students, departmental research topics, the research outputs, and then just an overview. So this is our mission statement. I'm going to tell you what I tell our honors students, which is that I don't read slides. So you can read it, but what is most important is, in terms of research, the second one, to engage in ongoing curriculum and research development, which is innovative, sustainable, and needs-driven. So at present, our staff and students are that we have 13 permanent academic staff, 2 of which have just resigned. So we have 11. We have 6 programs with additional 2 in development. And we also run, between us, 2 community clinics. So we have somewhere between 2,000 and 3,000 undergraduate students. My module, which is the 3rd year research module, is actually the smallest, and I have 500 students in that module. I'm joined today by 2 of my beautiful staff members, our Deputy HOD, Dr. Lambert, and then Mrs. Lisa Curran. And they work much harder than I do, which is, you know, why I have to stand here. Then, in terms of our actual research students, we've got 50 BA honors students, 19 clinical psychology, 22 counseling psychology, 31 research psychology, and 18 PhDs that we supervise between the very few of us. So that's 140. In terms of M&D numbers, we account for about 1/3 of the total number of M&D students for our faculty between the few and faithful staff members that we are. So we are very hardworking. I looked at our departmental research topics, and it's a long list, which is why we all work in the department, because it's so interesting and exciting to find a student wanting to do innovative research. But the main trends I could spot were obviously health and wellness, then community psychology, psychological assessment, relationship psychology, sexual abuse, cyber psychology, lifespan development, cross-cultural psychology, personality, substance abuse, gender studies, etc., etc., etc. It goes on. And any research study that we supervise can actually draw from not just 1, but 2 or 3 of those themes that we then embody in one research study. So, and human development is so diverse that we'll never run out of topics. So just celebrating some of the research that is currently being done, and really this is, I had a battle trying to figure out who to showcase. It's about, if we look at just broad stroke topics, it would be the effects of childhood trauma, and substance abuse comes in there, mental illness stigma, parental incarceration, and obviously the impact on the mental health of adolescents, again, substance abuse, African spiritual therapy, spirituality and therapy, traditional healers and treatment of mental disorders, also looking at notable authors from the past that have not had their voices heard in Western media, in developing their therapeutic modalities and what their theories were, looking at post-COVID syndrome, psychological implications of stuttering, female objectification, and it really goes on and on and on because we've got so many students, but those are just a few. Ones that recently graduated would be social media support group for mothers, addiction in online relationships, HIV and AIDS, and parent-child relationships. We are also have looked at the influence of culture and religion on the coping strategies of residents in the Eastern Cape, culturally adapted psychological interventions for mental illness, Griffiths 3, which I'll speak about a bit more just now, then caregivers' perceptions of their children's well-being when they've been diagnosed with ADHD, and of course the well-being of students, because that's an important topic for us as well. Something I want to highlight is that last year Melody Peters, one of our master's students, won the award at the university for the best master's degree by coursework at the Nelson Mandela University. So that was quite a proud moment for us. And her supervisor is here, Mrs. Curran, so well done to them. Conference presentations. I just had a chat earlier with Prof. Nanette about cannabis use, and so we have one of those presentations there. And cognitive behavioral therapy. There have been things on at IPE presentation on contraceptive uptake among school-going adolescents, the psychological impact of unemployment and coping mechanisms amongst graduates, the use of disaggregated data to report developmental information for a child with a development quotient of below 50, so those that have a severe disability, promoting the children's right to assessment with the Griffiths Development Gauge, and round, up and down, using the Griffiths 3-wheel to interpret and report test findings. And those are just really just examples. These are publications from the last 2 years, just a few of them. Our dean did a PhD through our department. I was her co-promoter, whatever that's worth. And she did a study on catatonia, and I had to learn what catatonia was. And so she did it by articles. And so there were about 4 or 5 publications that came out of that. And influence of culture and religion in coping. So that came up again. Story-linked item design and gamified tablet-based assessment for preschool children, which is also one of my PhD students who completed that. Guidelines for revision and the use of revised psychological tests, which was my own PhD, which I did while I was supervising other PhDs. Alcohol awareness, knowledge and practices of pregnant women in the Missionville area, one of my master's students. What are the options for reporting below the floor of the standardized test, and then describing an online co-development process of violence against women and girls prevention intervention. That was one of our PhD students with our head of department, Prof. Maggie. So that was Jane Ndungu, for those of you who remember her. What I really want to showcase is the Griffith Scales of Child Development, which is a very proud association we have with the Association for Research in Infant and Child Development in the UK. It's really in South Africa, spearheaded by Professor Louise Stroud from our department. I have been involved in that test, in the development from 2012 onwards. So she is the lead researcher, and I did the psychometric research for that test. And I'm still involved in that association, as is she, but I am as the statistical consultant. And it is the gold standard for child development testing around the world, and it's being used in just over 60 countries. So lots of translations, adaptations, etc., especially in Africa going on. And we're very busy with that. And then the last bit of work, the most recent, is the Griffiths three-wheel of interpretation and reporting, in which we really tried to conceptualize as health practitioners how we would interpret what we observe in our patients, clients, and participants. And firstly, you'd look at what is happening within the person, just the overall picture. Then we would also look at between the subscales, meaning all of those different bits and bobs that we've assessed. What is happening? What is a significant strength or weakness for that child or that participant? But then we have to look beyond all of that. What surrounds them? What is the community that they come from? Who are they really within the context of who they are? Because we are not here to fix anyone. We are only simply here to understand them and help the world around them better adapt to who they are and to build those networks to support them in their developmental trajectory. So that's a little bit of what we do, and really just a tiny little bit, but I only had so much time. So thank you for listening.
Thank you very much, Prof, for the showcase. Oh. Putting it out into the universe. So thank you so much. Thank you so much, Doctor. That was a very interesting presentation. And I must say, your department has a lot of students and there's a lot of research that comes out of it. And I don't know how you guys do it because it is a bigger department compared to others, but still the staff member ratio compared to the students is still quite a lot. So I think it's something that we all go through when it comes to supervision and having a lot of students and trying to get outputs. Are there any questions on the floor online? Nothing online. Anything on the floor? Comments, suggestions, collaborations? Okay.
Thank you so much for the awesome work. Just to mention, maybe some colleagues in other departments may have seen the list of output with systematic reviews, copying, integrate. So please, if your department would want to actually have more skills in that, please, you can let the Research Directorate know. We are currently running 2 groups after the MRC Cochrane department actually had the workshop with us, and we've been engaging on that. A few colleagues here are in that group. One group just registered their protocol in Prospero, and the other is about to submit. So please, you would like to know if your students actually want to use that opportunity, especially the undergraduates. You know, it's actually time saving for them. And it's very informative because they will gain a lot of things via the literature and all that. So just saying, in case we do need that, please drop your name or the name of your department so we can make plans with the colleagues in question. Thank you so much.
Okay, just a question for my side. So I think about last year, we had a master's student that was applying from outside. And I think their topic was linked to our department. So I think they did biokinetics, but they had a psychological aspect to their topic, but they end up not registering. But I want to find out when it comes to collaborations, because we want to encourage more collaborations, but how does it normally work with supervision? Let's say a student is in my department and they also have an aspect of psychology or any other department. How would the supervision happen? Because I know in our department, I think only Dr. Kolvadia has supervised across different departments. So how do you normally go about that?
Actually, we do that quite a lot. So it would depend on where the student is registered, because obviously whatever their main topic is would be the department. Apparently, I have a pitchy voice. but our staff member would then come on board as a co-supervisor. Mrs. Curran has experience in that anyway, so as have I. So we do a lot of that. Okay.
Thank you very much. But I was quite interested because I was going to supervise the students, so I was quite looking forward to collaborating with another department in terms of supervision, but it never got to happen. But I'm hoping in the future with the collaboration talks, we can actually get to a point where I get the experience to collaborate with another department. Thank you. Okay, now to our fourth departmental showcase, we have Prof. Soji from Social Development Professions Department.
Is it still a good morning? Good morning, colleagues. So it's interesting that I'm the last one to present on supposedly showcasing, but we're taking a different approach in the Department of Social Development Professions. That yes, we have various projects or various research studies or research projects that we could showcase, but the department decided to rather, instead of presenting everything that we do, they decided to identify a project so that we can give an example of the research that is conducted in the department, showcase that, as well as give examples of how we're also collaborating, not only interdisciplinary, but also transdisciplinary research. The intention also for me is to speak to you about the importance of participating in SASOF, because this study is part of a SASOF, SASOF being South African Swedish Universities Forum. And I noticed that not everybody in our faculty participates in that. And this also serves as an opportunity for it. So as you can see, the title of this is Society-Based Intervention to Combat Childhood Malnutrition in South Africa and Sweden. And this project was initiated in 2019. At the time, Prof. Pepeta was still with us. And it was initiated by Prof. Pepeta, Prof. James, and myself. And this was part of the SASOF 2019. And we were doing this in response to the challenges related to childhood malnutrition. In our province, there were newspaper articles. There was a huge cry because there were reports that children were dying, especially here in Eastern Cape. But we were also aware of malnutrition in other parts of South Africa. And we were looking at what are some of the challenges that were linked to malnutrition. And we were able to, one could be able to see the socioeconomic disparities that were identified as the key primary reason why we were facing malnutrition. And in South Africa, we were seeing that there was both undernutrition as well as overnutrition that was a particular concern. So we participated because we had a satellite. SASOF usually runs annually. And there are satellite events where participating universities are hosting SASOF events. It's hybrid events. Different people can join your event. So we hosted an event in 2019 when we initiated this project. And when we were doing our literature review, we could identify that the key driver, these are the key drivers for malnutrition within the South African context. Of particular interest for us was identifying that if you look at the fourth bullet, that fourth bullet is the biggest issue in Eastern Cape, the late identification of children with severe acute malnutrition at community and health facility levels. In Eastern Cape, even though we speak about overnutrition, in Eastern Cape, we're struggling with stunting, which is undernutrition. And they say that the late identification of these children becomes a concern. That is why we end up with high numbers of children who are even dying as a result of this, as well as inadequate health care infrastructure This list is not exhaustive. There are many, many other drivers of malnutrition, but we highlighted those. This was a South African context. We then looked at a Swedish context because in 2019, when we participated in SASUF, now SASUF enables you or grants you an opportunity to present your research. It's a platform where you are able to, once you presented your research, in that platform, you get collaborating partners in all the universities in South Africa, as well as participating universities in Sweden. So when we participated in this, we were able to identify a collaborating partner, Uppsala University in Sweden. And in exchanging our data, we were able to get information about their context. So even though they are a high income country, and they have less socioeconomic disparities, we've seen that they are also not immune to the issue of malnutrition. Whilst we're struggling with both over and under, their concern is mostly in terms of childhood obesity. And these are the stats that one can be able to see, which indicates the need to move towards societal prevention programs. So the question is, so what? So we looked at the fact that although the content and the types of malnutrition may vary, but the underlying causes and their intersections are very similar in both contexts. And therefore, there was a need for us to have an understanding of successful approaches that are presented in various contexts so that we can be able to learn from those approaches. So in 2019, as I said, we had a SASUF week. We deliberately invited people from grassroots level. It was a stakeholder engagement workshop attended by community leaders as well as our local government officials. We sat around the table in order to be able to understand what is the prevalence of malnutrition. That's where we were able to gather that in Eastern Cape, we have undernutrition and especially stunting. There were studies that were conducted in South Africa. We conducted qualitative studies. We involved postgrad students as well as fourth-year students, both in social work and in dietetics. Our fourth-year students focused more on nutrition and food insecurity or food security. In Sweden, there was more quantitative studies that were conducted. In 2020, we had to stop. In 2021 due to COVID. And then in 2022 up to now, we have more universities that have joined us in the project. In the last slide, you will see who are our collaborating partners. What have we learned? So we meet every Friday as these collaborating partners. We exchange literature. We've identified that any intervention that must be successful has to be evidence-based. So we meet, we share resources where we give each other homework, we review literature, we look at national surveys, what are they telling us? We've also learned that any intervention that must be presented has to follow a systems approach that would take into account the wider determinants of health. So you can't look at malnutrition as a nutritional issue. It has to look at environmental factors. It has to look at wider determinants of health. We also identify the importance of the co-creation of interventions, that it cannot be academics, it cannot be government. That co-creation of the interventions is important, and the critical role that must be played by government has been highlighted here as very key. So we are now working with government departments, Department of Education, Department of Health, and Department of Social Development. We have a collaborating partner in Venda, and they are looking at the Vembe district, and we are also involving government departments in Venda as well. And we also identify the need to have our data infrastructure in order for us to be able to monitor and follow up and evaluate. The view is to build the ecozone. It's the end of childhood obesity, but in South Africa, it will be end of childhood obesity and stunting. The discussion is around, are we going to build this ecozone in Eastern Cape or in Free State or Western Cape, because in South Africa we have, or in Venda, because those are our collaborating partners. We still need to discuss this. This is an example of an ecozone where you have various stakeholders. As I said, from government, you identify a city and you have all your interventions. You have to co-create intervention measures that are going to be sustainable, and then you focus your energies and your resources. You advocate for government to be able to pull those resources, and these are the collaborating partners, the various stakeholders that would be collaborating. And then once you learn from real life experiences, your learning then can be able to be taken to other contexts as a way of upscaling the interventions. So our next step in this project is to build the data infrastructure, because we know stunting is very, very difficult to identify if you're not going to have your infrastructure, and then also being able to build the eco-zones. I want to show you an example of this data infrastructure that we as a collective, we are looking at, where you're going to have quality register, and then you have family health data, you will have data, research findings, and then you have healthcare data as well as municipality data, as well as individual and societal data that's going to be available. Because once we have all of this, we will be able to address this, because the biggest challenge we've identified was that we rely on outdated data, and interventions that are there have been presented or have been developed based on outdated data. This is what we want to do. And these are all the collaborating partners. If you can see, it's very interesting because it's transdisciplinary, from medical specialists to social workers, as well as people in nursing. And as I say, we meet religiously. We have a standing appointment, just 1 hour on Fridays, where we meet as a collective. We share resources, we share articles, we inform each other on this particular phenomenon. Thank you.
Thank you so much, Prof. I think hearing all these showcases really emphasizes the need for collaboration, because taking from your presentation and the presentations that were done now, I see big opportunities for collaboration, because with stunting and specifically overweight has been the focus of the research projects that we've been doing at the HMS department. And we also collaborate with the Human Nutrition and Dietetics department. And we currently have a project running now in Zwide. And another thing with undernutrition, specifically stunting, we also found in our previous studies that helminth worm infections play a role, so which is linked to the LMS department. So I think everything that we're seeing in the different collaborations or studies that we're doing, we can really try to connect and work together, because we're doing the same thing, but in different projects. So I think it's really nice to see the different departmental showcases, and we get to a point where we can have a sit down and see how do we collaborate, so that we don't reinvent the wheel, but we use what other departments, other researchers have found. So are there any questions on the floor? No questions? It's really phenomenal work, yeah. Okay, if there are no questions online and on the floor, we can move on to our next speaker. So now we have now a research presentation by Mrs. Machikure Chiure, who will be looking at advancing resilience in the face of adversity, a psychological exploration of Chimanimani's experience with Cyclone Idai and COVID-19.
What is this? And because. Okay. A very good afternoon to you all. I'm another person with the problem of voice with a high pitch. Let's hope there won't be feedback. Is it okay if I stand that side? I prefer that side. Thank you. Since it's my first time to be here at my university, I'm a part-time student, PhD student in psychology, and I'm happy to be here. And I actually, this research is actually a research article emanating from my research thesis. Actually, my research thesis is on using the multi-system models model of resilience among the Chimanimani vulnerable communities of Chimanimani district in Zimbabwe. So I used the mixed methodology approach. So this article came from my the qualitative component of my methodology. That's so this is under review for in a journal, essay journal, for my PhD submission for the PhD qualification. And then the research is entitled Advancing Resilience in the Face of Adversity, a psychosocial exploration of Chimanimani's experience with Cyclone Idai and COVID-19. Now, the problem and the setting. Chimanimani is a district in eastern Zimbabwe. It offers a critical case study for understanding the psychosocial effects of consecutive disasters. Why? Because it is a high prevalence of vulnerability among its population, and also it faced the devastating impact of consecutive adversity. For instance, it has been subjected to a series of cyclones. For example, there was one in 2000, Cyclone Eileen, and then there was Cyclone Dione, Cyclone Japhet, and then the most devastating one, which had the largest impact, was the Cyclone Idai of 2019. And then soon after this Cyclone Idai now, there was the COVID-19 pandemic, which came in, became very popular, mostly in, became very serious, mostly in March 2020. So considering the situation that the inhabitants and communities of Chimanimani had been facing, they were still trying to recover from COVID-19, from the Cyclone Idai impact. And then comes the COVID-19. And now the lockdown restrictions, which were imposed by the Zimbabwean government in March 2020, actually was a bitter reminder to the people of Chimanimani, because they are to be now secluded and isolated from the rest of the world, just like what happened when the Cyclone Chimanimani hit, whereby approximately about 634 kilometers of long roads were destroyed, and also about 1,481 homes were destroyed as well. About 340 people died, and approximately about 51,000 were displaced. So they were still trying to recover. And then comes the lockdown because of COVID-19. And then the nature of this new disease, COVID-19 pandemic, which actually implied death and losing of loved ones, which they'd experienced during Cyclone Idai, actually was a bitter reminder of all those anguish and psychological distress they had been through. So that's the setting and the situation. So by exploring the experience and perceptions of community members, this research sought to identify factors influencing resilience and inform strategies for advancing resilience in the face of adversity, and inform evidence-based interventions. Now, the aims of this study, it sought to investigate psychosocial effects of their consecutive disasters on vulnerable communities in Chimanimani. Now, subsequently, the study aimed to, 1, investigate the experience of perceptions of community members, 2, identify factors influencing resilience, and 3, inform strategies for advancing resilience in the face of adversity. Now, this the theoretical framework for this study is actually was based on Bruford Brenner's 1979 ecological systems theory, whose concept actually highlights the interdependence and interconnectedness of various systems that impact human edification. So we are saying for the human, in this case, we're talking about their ability to be able to resilient, to go on. They're saying it can also be what? Linked to the ecological systems by actually looking at it from the various levels that consists that is embedded in random business theory. So from the individual or the community in this case, linked to the microsystem. So you can see from the arrows that these systems actually are interconnected and they can impact or affect each other. Then there's the microsystem. We're talking about the immediate family. Then the meso, we're talking about the interaction between the various microsystems, then the exosystem, the macro, and the chronosystem. So why the ecological theory theoretical form? In other words, are now explaining how each of those levels is linked to this research. So we are saying in the context of this research, the ecological system theory help understand how vulnerable communities in Chimanimani districts interact with their social, economic, and cultural environment that is shaping their experiences and resilience. So at microsystem level, if you remember the diagram, the vulnerable communities in Chimanimani district are their experience and their interactions are embedded there. And then the mesosystems concerns the interactions between community members, local organizations, and authorities. And then at exosystem level, this involves now the external factors like government policies, economic conditions, and global events such as the pandemic COVID-19. Then at macro system level, we're considering the cultural, societal, and political context of Zimbabwe and the Chimanimani district. And then at a chronosystem level, the impact of the historical events, we're talking about such as Cyclone Idai and the ongoing challenges on what? On community resilience. Now, the methods and procedures for this study employed a qualitative phenomenological approach to examine the experiences and perceptions of Chimanimani communities. And then a purposive sampling strategy was used or utilized to select a total of 27 participants for focus group and in-depth interviews. So the semi-structured interviews in the focus group discussion guides directed the data collection process. And then the study included 7 key informants. Then these are employed by government ministries and departments. Now, these participated in the individual interviews, and then 20 community residents who participated in focus group discussions across the 5 wards which were under study. And then participants were aged between 33 and 56 years and had experienced Cyclone Idai. Now, it's actually, I don't know how it happened, but it's actually found that for this qualitative, it was mostly those ages, but for the quantity aspect, there were participants, some who were 18, 19, and in the groups of 20s, but for the qualitative aspect, it was only this age group range which actually participated. And then thematic analysis was employed to analyze the data, revealing patterns and themes through coding and categorization. Ethical approval was obtained from the Institutional Review Board. I'm talking about here from the Faculty Postgraduate Ethics Committee, and then the Research Ethics Committee, UMaine Mandela University. And then informed consent was secured from all the participants. And then the ethical considerations were upheld and confidentiality was ensured. So due to the sensitive nature of the study, some participants who exhibited distress or emotional distress received crisis intervention and counseling service from registered psychologists. I actually experienced that during my data collection. Some became very emotional and they needed this sort of intervention then. And then the results, the findings of this study reveal a complex interplay of factors affecting resilience in the face of adversity, including psychological distress and social dynamics. Now, these findings also reveal suggested approaches to advance resilience in the face of adversity. So the psychological component, some participants reported secondary trauma, having witnessed others' experiences, while others shared personal accounts of their own experience. For instance, one participant said a woman who lost her family cycle and now avoids activities she once enjoyed, like playing netball, and refuses to participate in discussions about the disaster. And then another participant said, I feel like I'm living in a nightmare. I can't wake up. Another one said, I've lost interest in activities I used to enjoy, and I feel like I'm just going through the motions. And then the other one said, I survived cyclone Idai by climbing a tree with my son and others. My son still avoids my workplace, and I lost a brother to COVID-19, which brought back traumatic memories. So these findings reveal a range of emotional struggles and psychological distress related to the participants' experiences with cyclone Idai and the COVID-19 pandemic. Results continued. The social dynamics from the findings, participants reported that the cyclone Idai disaster and the COVID-19 pandemic have exacerbated GBV cases, particularly domestic violence, drug and substance use among the youth due to economic instability and stress. Then one participant mentioned that GBV cases are high, mainly domestic violence between couples, which are exacerbated by poverty and COVID-19 lockdowns and affecting men and children's mental well-being. Now, cyclone Idai, another one said cyclone Idai led to the child-head family. They are now child-headed families exposing children to abuse, early marriages, and substance use, negatively impacting their mental well-being. Then another one said girls in our community are engaging in intergenerational relationships with older men for financial support due to poverty, often with minors, foreign workers, or married men. Then another one said the relationships led to STIs, lead to HIV, unintended pregnancies, and teenage motherhood, negatively impacting the girl's psychological well-being. Now, someone else said the neighbor's son is threatening his elder mother, claiming inheritance rights after his father and brothers died in the cyclone, causing the mother significant distress. And another participant said youths in our community are hosting parties in forests to exchange drugs and substances, including girls who are actively involved. They are stealing from their homes to fund their drug habit, and it's consuming their lives. Now, these findings indicate a growing substance abuse problem among the youth in the communities, fueled by factors like boredom, peer pressure, and the desire for escapism. Now, the approaches which were suggested by participants, which can advance the resilience in the face of adversity, it actually reveals the community-based interventions, also psychological, mental health services, psychological support, and the awareness empowerment. Now, one participant mentioned that mental health experts are needed to provide crisis counseling, education, and support to individuals and families affected by the disaster. Another one said local officials should be trained to offer psychological first aid services to reduce the risk of severe mental disorders in community. Then another one mentioned online mental health services would improve care, reduce costs, and delay in accessing services, especially for those exposed to traumatic events. Then another one also said education on drug abuse, gender-based violence, and child abuse is crucial for promoting resilience in vulnerable communities. Another one also mentioned that men in this community need education on gender-based violence, equal opportunities, and mental health to stop abusing their wives and hindering their economic empowerment. Then the other participant again said the crisis affected mental well-being, leading to a need for mental health services, but lack of local facilities forces people to travel to Mutare for treatment. Now, Mutare, that's where there is a provincial mental health center. So in that district, they're saying there is no mental health center. So these suggestions demonstrate clear understanding of the community's needs and the desire for holistic support. Now, the conclusions. In other conclusion, this research underscores the significance of theoretically informed and contextually sensitive strategies for advancing resilience in vulnerable communities. These findings also highlight the importance of integrating psychological, economic, and social support services That's acknowledging the critical role of community solidarity and cultural heritage in coping with diversity. So by informing evidence-based intervention, this study contributes to the advancement of resilience in Chimanimani, promoting sustainable support for communities facing consecutive disasters. Furthermore, President study findings contribute to the existing literature by addressing a significant knowledge gap regarding the psychological consequences of cumulative adversity exposure on vulnerable communities. Now, this research contributes to the understanding of disaster resilience, highlighting the need for contextualized and theoretically informed strategies. Consequently, the findings of this research argue for a contextualized approach to promoting resilience, incorporating community-based initiatives, economic empowerment, and policy support. Thank you. Nyabonga, tinotenda.
Hey, thank you so much for the presentation. Do we have any questions on the floor?
Thank you, ma'am. It was a very enjoyable presentation. I just wanted to know, in terms of your recommendations, your conclusions, and so on, in the absence of community resources, I would think that a lot of infrastructure was affected and destroyed during the disaster. Now, how would the recommendations then be practically implemented? Because I think you were talking about policy, organizations, community-based organizations that have responsibility towards the survivors. So in the absence of community resources, how would that then be implemented?
Thank you very much, ma'am. This actually calls for a multi-sectorial approach. Of course, the resources are needed. Right now, actually the community is struggling for the resources. So it means all stakeholders, we're talking about the users and the service providers and the civic community actually have to come together and offer their various services to make sure that these resources are what are provided, so that the community might benefit, and then it will also help in the promotion of of their resilience in such situations.
Do we have any more questions on the floor online? Okay, just my own question. I think I actually wanted to ask a similar question, but I had two more questions. I just wanted to find out about your own experience conducting the study, because obviously you had to interview people and get to witness people getting emotional distress, just thinking about the previous events. So just how was that experience for you while conducting the study? And also to find out, were you the one providing the counseling or the psychological intervention after people were distressed?
Okay, thank you very much for that question. Yes, this type of research, it was a very sensitive one. And as soon as I got in touch with the district coordinator, she actually told me that in this district, the issue of Cyclone Idai is still very, it's a very sensitive issue. And they are likely to get mixed feelings and responses from the participants. And even the community ward coordinators who then helped me recruiting participants actually said the same thing. So when I was applying for my for the ethical approval, the ethics committee actually indicated that I had to actually engage a psychologist in case such instances happened. So I had engaged one, a counseling psychologist. Of course, I'm also a psychologist, but I had engaged one who, for those what purposes. And it actually helped a lot because she was there. And then the other question, Sorry, sorry, the second question you had questions.
No, I think you've answered it. Just one more question, because I think what your study really showed, besides the adverse conditions that people had gone through, it highlighted other problems, such as, I think you spoke about intergenerational relationships, because young girls are wanting financial support, and also with gender-based violence. So I know most under-resourced or underprivileged communities, that is something that is a problem. And you mentioned that the community itself doesn't have facilities to provide any psychological support, and they have to go to the Mutare district. Yeah. And I can just assume that it's maybe far, but is that government facility, is it well equipped to assist the people in the community that have gone through all these adverse events, especially with men, just giving them more information about gender-based violence, and also supporting the young girls and women specifically after experiencing everything?
Oh, you're talking about the one in Mutare?
Yes. Is it well equipped, and how far is it from the community?
It's very far. What's about 2 hours? 2 hours by bus. That's the distance, you can imagine. But at the same time, it's also experienced some problems, because they used to admit patients. Now they cannot, because they need more resources. So it's still a very, very it's still a big challenge. So a lot needs to be done concerning that.
Okay, no, thank you very much. It was a very interesting research, and all the best going forward.
Thank you very much.
You. Okay, now for our last speaker of the session, Ms. Case Neyman, who will be giving us a presentation on student entrepreneurship.
Hi, everybody. I'm not sure which side is my best side. So, hello, everybody. I'm Karen Snyman, and I'm Specialist Student Entrepreneurship at Mandela University. I'm also the chairperson for the Community of Practice for Student, the national chairperson for the Student Entrepreneurship Community of Practice, which basically enables student entrepreneurship within universities. Also serve on the SWEEP, which is Student Women Economic Empowerment Program, National Task Team, to also support female student entrepreneurs. So, Umandla, to all the women, and happy Women's Day. So I'm nervous, so I just thought I'd just breathe a bit. I don't know if you want to stretch with me. I think you need to stretch your legs, right? Yeah, we've been sitting very long. So I was grappling with what I wanted to share with you, but I thought I'll just share with you the national landscape of where we find ourselves, and then share with you institutionally what we have done within the space of student entrepreneurship. Just as a disclaimer that I'm the only one permanently in the space, and I'm sitting here with Mito, who also works in my office, with Fidel, and Zimasa. Zimasa's the content creator, so I have to make sure that she's got my best side. So, and I prepared some notes, guys, so please forgive me if I don't have eye contact with you. But so student entrepreneurship in South Africa presents a unique opportunity to drive economic growth and social change in a country which is riddled with significant economic disparities, a pressing need for innovative solutions to social changes, and of course, high unemployment rates. Now, if you look at the graduate unemployment rate, you'll see there that we have the highest unemployment rate in Africa, which is over 50% youth unemployment rates. We also have a high graduate unemployment of 33%. This was done in 2023, the 33% group between 15 to 35. 1 of 3 graduates will struggle to get employed. And noting the gender imbalance that 10% more men are absorbed into the workplace than women. So this is what we are currently sitting with, and self-employment and entrepreneurship has become more important among graduates due to the lack of conventional work options. In 2021, 13% of adults in South Africa were involved in early stage entrepreneurship. And this is according to, I don't know if you're familiar with GEMS, with Global Entrepreneurship Monitor, which monitors entrepreneurial activity within South Africa. They are a research entity. Over the last 5 years, the number of university graduates working for themselves has grown by about 25%, according to data from CEDA, which is the Small Enterprise Development Agency. This highlights South African graduates' entrepreneurial potential and tenacity as they look for different career paths to open up their businesses. Now, acknowledging this potential, universities in South Africa are placing greater emphasis on entrepreneurship, education, and related services, enabling graduates to take charge of their own prospects and use innovation and on entrepreneurial endeavors to promote economic growth. Now, it has been found that students who have, now we're not saying that every student must become an entrepreneur, but we are saying that let's equip students to have entrepreneurial thinking. And I've read research which said students which have entrepreneurial minds, it's an entrepreneurial thinking, they become more, they are more innovative. They become actually more employable because of the way they think. They have more innovative thinking, more creative, and just out of the box kind of thinking. Student entrepreneurs bring fresh perspectives, innovative ideas, and a willingness to take risks, which can lead to the creation of new products, services, and technologies. Now, can change the slide, Mito. That's why I brought you. So we are just a part of the whole student entrepreneurship landscape. The university did a reorganizational design. They identified, they've repurposed the role, which is my role, into a specialist role, specifically focused on student entrepreneurship. And that was very progressive to sort of identify a specific role for entrepreneurship. I can say that I think that we are the only university in the country who has a specific person working specifically with student entrepreneurship, which is actually breakthrough. So we are part of a bigger vision. There's a bigger vision happening at the university where they are trying to create what is known as the Mandela Africa Hub. So we are saying that let's start looking at Africa solutions for Africa problems. But we're not only saying that, right, Fidel? We're saying let's find Africa solutions for global problems. And this is where we will position ourselves within the university as part of an enabling strategy to enhance entrepreneurship, not only among students, but also youth in our country and regionally, nationally, and Africa as a whole. So let's go back to the Mandiba's Youth Entrepreneurship Lab, which will be my focus. I will just share you a few of the things which we have done. So we had to make sure that we align ourselves. We had to make sure that we align ourselves as Vision 2030 of the university, which speaks to me. Where did my slide go? We had to make sure that we align ourselves with Vision 2030. In Vision 2030, it states that we need to provide curricular and co-curricular experiential learning opportunities that cultivate innovative entrepreneurial mindsets and enhance the readiness of graduates for life and work. And we have done this by leveraging of the energy, the creativity and resilience of student entrepreneurs to address some of the most pressing issues facing our country. And of course, the main one, graduate unemployment. So we have adopted 4 main focus areas, and this is 4 of our main focus areas. It is to really commit to solve societal needs in our community, of which youth unemployment is one of the biggest challenges, to create an enabling environment for our students that empowers them in developing sustainable businesses, to equip them with skills so that they get get things done, develop mindset, and of course, centered around people development to promote entrepreneurial culture and welfare. So those are the four main focus areas on which we have built the Madiba's Youth Entrepreneurship Lab. So we have, since about 2018, we have started from the bottom up. We've, we basically done our research around this and just engaging students on what students want and what are the needs of students, because we realized that we needed to have a bottom-up approach, because coming from a student governance and development background, you'll find that when students are involved in the decision making and in the participating in the discussion, they tend to support it. And therefore, we had to sit with students, ask what do students want? And out of that discussion, that bottom approach, this was born. These are just some of the programs that we're involved in. And I think for a short space of time, we have really just boomed. So that photo there, by the way, is within the Center for Entrepreneurship, but I'll share that later, what's happening there. So we developed a policy which allows students to develop businesses on campus. This is a policy where we identified certain spaces on campus, the residence tuck shops, containers, and so forth, spaces where students can learn skills to operate a business, but we don't leave them there. They have to obviously submit documentation. They have to register as a business plan, etc. And then while they're in that program, which is almost like an incubation program, we teach them skills. And in that skills, they learn how to work in a group. They learn how to deal with different kinds of people. They learn finance skills, all sorts of business skills to enable them to grow business. And at the back there, Leleto, she's a health science master, in a master's year. She was one of a tuck shop owner. And when she came to see me at the end of the year, she said to me, ma'am, this was just the start of my journey. I am really considering becoming an entrepreneur, becoming self-reliant. So this is the kind of thing that we want to encourage and grow within our student population, helping them to become self-sustainable, self-reliant young people. One of our students who owns a driving school on campus, he's at Sanlam Student Village. He started off with one car in his first year. We gave him a space. Vodacom sponsored me a container, put him there. Today he has about 4 cars and 2 trucks, and the guy's making money more than me. But the guy is honestly just and the beauty of on-campus businesses is that, I must mention, is that students employ other students, and this is job creation right on our doorstep. So you find that on average, there's about 13 businesses ranging from driving school. We have a student who does alterations, a student who's selling water, running tuck shops, and so forth. They are employing other students, and on average, they create employment for about over 30, 40 students. And these are normally students who are non-funded students, and so this helps them to survive. And as we spoke about hunger earlier, you are aware that student hunger is a real problem on campus, that we are sitting with a big problem of student hunger. And I always say, when I look out of my office and I see the snake of students, line of students queuing for food, I realize that the problem is actually much bigger than what we think it is. So that is just one of our programs. We also got funded by the University Capacity Development Program called SEED, and it's basically, it deals with employability, where we have employability online workshops for students, but it's very practical. For example, how to promote yourself on LinkedIn, various employability issues we deal with. And then we also we have a SEED mentor program where we have students who have been in business for more than 2 years, taking on other students and mentoring them. We also do this on our George campus. So it's a mentor program. And of course, networking. Every entrepreneur needs to know how to network. It's a skill that is invaluable. Even if you are a student, you need to know when you go find that job and you speak to people, how did you get your job? Through networking. So you need to build that networking. So we teach them how to network as well. Then we started last year with a township a program for youth entrepreneurs, and this is Mito's baby. We started last year a Saturday program for youth, for entrepreneurs. We found that there's a lot of entrepreneurship happening in the township, but it's not formalized. They do not know how to do their business plan. They do not know how to apply for funding. And there is so much funding available for youth entrepreneurs that we took them, and a group of 20, right, Mito? And we had a 8-week Saturday program with them. And by the end of that program, they have now joined our incubation program. Some of them, some of them have developed into fully blown businesses, while others are, it's not easy being an entrepreneur. But we will roll out our next Saturday program at our mission. We normally run it at Missionville campus for youth. Emergence of Innovators program, that is a program where we rolled it out now this year. And Fidel, sitting over there, he is responsible for, he's our student assistant in the space, and he conceptualized this program on Emergence of Innovators, because we're saying, let's look at students who are not entrepreneurs, put them in a room and see by the end of our 6 weeks if it will awaken some kind of entrepreneurial mindset. And so we put them through a program of design thinking, how to become what is an entrepreneur, what makes an entrepreneur, and various other modules that we will do with them over the 6 weeks, and then they will pitch at the end. And then we will sort of, see, is this program working and how can we develop it further? It's an on-site Moodle program. It's also a physical. We have partnered with lecturers within the business school and faculty of business science to present these programs. So it's really growing. Then we have aligned, you can skip, I will skip that. We can go to the next slide because I'm going to speak forever there. So we have also aligned nationally. So in 2016, Department of Higher Education and Training, as well as USAF, which is University South Africa, started EDI, we call it EDI, it's Entrepreneurship Development in Higher Education. And this is a national body which creates and develops entrepreneurship within all 26 public universities. So what has happened is that, I just want to read a bit about on my notes here. So on the aims of EDI, it's really to mobilize the national student and graduate resource to create successful enterprises that will ultimately lead to both wealth and job creation. It's not only for students, but it also has various communities of practice. So anybody here who is interested in entrepreneurship, there's 5 communities of practice. There's one for looking at the entrepreneurial university. So there's a chairperson chairing that community of practice. There's one for the teaching and learning. There's one for research in entrepreneurship, as well as the student entrepreneurship, and one specifically for students. So there's 5 communities of practice. And if you're interested in joining any of those communities of practice and learning more about the entrepreneurial space, you're welcome to contact me, and I'll give you contacts of people to get involved and join up that community of practices which exist within the university space. Am I still good for time? 1 minute. Oh my word. We have established a Center for Entrepreneurship, and that's a big smile of Dr. Lose, who's the unit head. He's recently appointed into our space. He's as a researcher as well. We established a center, which is an incubator, and I would like to invite you to come and have a look at it. It's a beautiful little space. It provides infrastructure. There's a boardroom. There's a maker space. There's a boardroom, a maker space. There's a hard desking space, and a training facility specifically for student entrepreneurs. We applied for the funding through CEDA, and CEDA awarded us funding. We renovated a student space at North Campus, and please, you're welcome to come and have a look at our building. And it's basically putting students through an 18 to 36-month incubation program that will leave them with entrepreneurial skills and business mentorship. And this program is not only for student youth entrepreneurs, but also unemployed youth. And I think one of our incubators is someone who owns a pharmacy in the township, and she doesn't really know how to run a business. So she joined our program so that she can know how to run a pharmacy better. So that is some of the work which we are doing. In conclusion, student entrepreneurship is a powerful catalyst for economic growth and social change in South Africa. Through collaborative efforts to foster innovation, create jobs, and addressing innovation, social issues. Student entrepreneurs can make significant contributions to their communities and to the country's overall development. To maximize the impact of student entrepreneurship, it is crucial to provide the necessary support and create an environment where young entrepreneurs can thrive. Through targeted interventions and collaborative efforts, South Africa can harness the potential of its youth to drive sustainable economic and social transformation. So that's all from my side, and there's our contact details. We're on Facebook, Instagram, LinkedIn, you name it, we're there. So if you are on Facebook and you have your phone with you, please go to Madiba's Youth Entrepreneurship Lab and join and see all the exciting work which we do in this space. Thank you very much.
Thank you so much, Ms. Sneeman. This really was an interesting presentation. I did say to our program director when I was looking at the speakers that this will be very interesting. And just to say a few things. So I'm from the HMS department, and most of our students, so there's the biokinetics program and the human movement science program. So the biokinetics program, 4-year program, after they're done, they can go practice as a bio. But with the HMS, which is a 3-year qualification, after they're done, they normally do honors, have to apply to other universities, or they can open their own thing. But you said something very important, that you aim to equip students with entrepreneurial thinking or innovative thinking. And I think that's something that's lacking in our program, because we know that our qualification is not in the public sector. So students have to fight for jobs in the private sector, which are very limited. So we have some of our bio students that will open their own private practice, but it's almost sometimes like they're being set up to fail because they know the bio side of things, but opening a business is opening a business. It doesn't matter what it is. So I think that in our qualification, we don't really focus on giving them skills that will allow them to be able to open successful businesses. So I don't know if maybe your lab can maybe go have a talk at our department, or like, how do you think you would be able to assist us in that?
You know, it's been something on my mind for a very, very long time. And this is like, why we have doctors, but can a doctor operate a business? Does a doctor know how to do a business? I mean, I have a psychology friend who, because she didn't know how to run a business, she's a registered psychologist, a cum laude student, but she couldn't run a business. So I think something strong which faculties need to consider is to how do you actually do a module on entrepreneurship, a compulsory module on entrepreneurship, and sort of, you know, make it compulsory for all students, because everyone here needs to know how to start a business. Because what if you do not find a job? What if you start your own practice? Do you have the skills? Do you know how to run your books? Do you know how to build a client base, for example? Do you know how to network effectively? And that is something which faculty seriously need to consider, is to really look at having an entrepreneurship module specifically within their department. And I think that is something which we could sit down and we can maybe help you or assist you. I know that the Faculty of Business and Economic Sciences under Professor Farrington, she does a module program called, she partners with Wadwani Foundation, where they do an online foundational course in entrepreneurship. And that is sort of compulsory for learners to go through this honors course. And so we really, as faculties, I think need to shift its thinking, that shift its thinking from the traditional job seeker, because not everybody will be a job seeker. We need to look at the job creator as well, because this is what our country needs right now. We need people who are creating jobs. But you're welcome to come speak to us. You have my email.
I'll definitely be coming to you. And then also another question or maybe a note. So as I said, that some students, we don't equip them with the skills, but we have had a few students that have opened their own, because I know one that has a fitness center, not center, but he doesn't have an actual venue, but he does fitness boot camps in Zwede, and it has been very successful. So what I've done in the past is to ask him to just give a talk to the students, just to say it's possible, But I usually get comments such as, okay, I want to go to my community to start something, but these people won't be able to pay for this. So how do I sustain the business? So if maybe your lab or your center can just give them ideas of how they can do this, because I always say you come here to get information. So it would be very good if you can go to your community to start something. But now they don't know ways on how to get there, make sure that they get an income and they can be able to sustain the business. So I'm really gonna be approaching you just to get ideas and see if you can maybe do something for the department. But as you said, the faculty also needs this as a whole.
Thank you very much. And thanks to Prof. Melariri for inviting me. And definitely just email me and set up a meeting, and then we can discuss ways in which we can support students. I think it's such a crucial discussion that needs to be had, with a serious discussion that needs to be held within faculties, because I think you need to really look at just the graduate unemployment rate within our country is scary. And I mean, you go to a retail store and you find someone there with someone there, and that person is helping you, and you chat to that student only to find out that student is a graduate, and that's really sad to me. How do you stand in a retail store and you have a degree in psychology, you know? And I've met students like that, or a degree in something which they should be actually knowing how to actually become job creators. So without that skill, and you find that students who are not exposed to entrepreneurship don't necessarily know how to start a business, and they don't know which doors to knock on. And that's the challenge, is that they need to know that there's a door that they can knock on, and also to expose themselves to entrepreneurship. And I have a student in my office who, she started off as a PR intern. She's never been exposed to entrepreneurship. But because she was an intern in my office for the last 2 years, she actually launched a business last month, a PR business. So it's just the exposure to entrepreneurship that awakened that kind of drive to start a business. So we need to expose our students to say that there is, despite you not maybe getting a job, and there is an opportunity for you to look at entrepreneurship as a career. Thank you.
Thank you very much.
Thank you so much, Ms. Neyman, for the wonderful presentation. Colleagues, if you realize that day one of this research week, we gave a presentation on the FHS research strategy. And one of that, the strategic goals actually depicts creating opportunities to leverage health research entrepreneurship. And we emphasize on enhancing the employability of our students. So it was on that note we felt that it would really be of immense benefit if we could get started. And thank you so much for honoring the invite. But please note that we will be inviting you to the larger faculty to just give a similar chat, because when we hear it from the experts, it actually, helps us to plan accordingly. So thank you so very much. It's been quite fruitful.
Are there any more questions or comments from the floor? Okay, I think we've come to the end of our session, if there are no more questions. And lunch is ready. Yes, I'm not taking a picture today. Okay.
The phone, unfortunately, our photographer is not here, so we'll just take a quick pic here in front, and then we can have lunch through the glass doors. Thank you. If you go out to your left, thank you. We'll start again. Let me just check the time. 1:30. We will resume session 3. Thank you.
Oh yes, for the online delegates, we'll be back at 1:30. We'll resume session 3 at 1:30.